biomarker testing is important for everyone, but there are certain groups that actually it is particularly important to, including, in this case, African Americans. Now, when you think of lung cancer, most people think about, well, that happens to someone else. Well, interestingly enough, while most African American communities are familiar with prostate cancer and the devastation it causes and breast cancers, it still turns out that the number one leading cause of cancer death for African Americans in the country is lung cancer. Period. Now, many are afraid of the system. And to be quite honest with you, this is not one of these things in which we say, well, we should blow that off. There are many reasons that there have been mistrust and distrust of the health community, some well-deserved. Interesting enough, it becomes even harder when you have the chatter that's on the web and all these other places that you can now get information from that sometimes directly and deliberately gives wrong information. So I know it can be scary. But interestingly enough, Native Americans, African Americans, Latinos, we understand that biomarkers apply as well to African Americans as Caucasians, as Asians. Interesting enough, these things work. Now, in African American populations, it turns out that EGFR and KRAS mutations absolutely happen. P53 mutations or other things like that actually also happen. In fact, recent literature points to the fact that when it comes to differences between white and blacks in the context of biomarkers, it turns out that we have much more in common than we do different. However, there are some small differences, and those small differences can only be picked up by biomarker testing. What does that help you do? I've just stated that African Americans, the leading cause of cancer death in African Americans is lung cancer. So imagine now being able to not only get screened early and be seen earlier, but having your biomarker testing, one, identify that you have a very treatable cancer. It's a game changer. Now, I know in many communities, particularly African American communities, there's a sense of, well, it's in somebody else's hand, there's nothing I can do. 50 years ago, that may have been true when it came to lung cancer. 30 years, that may have been true when it came to lung cancer. But these days, the treatments are there. We can only give you the right treatment at the right place at the right time. Again, this concept of precision medicine, if you show up and are a participant in biomarker testing. Now, I wish biomarker testing was routine for everybody, but unfortunately, it's not. So if, you're Native American, Latino, African American, Caucasian, or from rural areas, now we've not talked about that, please ask your doctor when you go see them about the importance of biomarker testing and do they do it? There is a particular literature out there that says if you ask first, that we don't typically ask our patients, but if we ask them and if you actually prodded us, we'd have more people tested. And that's a good thing.